Scientists are close to bioprinting a pancreas that could help bring an end to diabetes. Over 450 million people around the world currently have diabetes. As each year passes, this number increases. Diabetes is a serious and often life-threatening condition. It's the second leading cause of amputation. It raises the risk of stroke or heart attack by about 9-fold, and it's the number 1 cause of blindness among adults. But now we have a new way to fight back. Readily 3D, a spin-off of EPFL, developed a new method to print biological tissues, and their system is blindingly fast. The process begins with a transparent shape on the screen, a tiny digital replica of the human pancreas. A biological gel containing the patient's stem cells is then fed into the system. From there, scientists use a laser to selectively solidify portions of the gel needed to shape the necessary tissues. It takes just 30 seconds for living tissue to be printed out on a bioprinter, blood vessels and all. The material is printed into a sealed environment to ensure it's sterile. Ultimately, the team is using this method to create a functional living model of the pancreas that is derived from human pancreatic cells, something that has never been accomplished before. This work is significant and has the potential to transform countless lives, as the pancreas is a crucial organ. It secretes a spectrum of critical hormones like insulin, which help regulate blood sugar levels by ensuring the sugar from food enters your cells so it can be used for energy. When pancreatic disease sets in, damaged cells become incapable of generating the insulin needed to regulate blood sugar levels. Diabetes, a disease in which sugar levels in the blood are above normal, soon follows. But thanks to this new development, a bioprinted pancreas could be created to exactly match a patient's own pancreas. This means patients won't have to try an array of drugs, some of which have very unpleasant side effects, to find one that works for them. The method also eliminates the need for animal testing. And that's not all. Ultimately, this bioprinting technology might also be used to build other types of human tissue. One day it could even serve as a way to produce entire organs for transplants, like a human heart. It's important to note that the technology is still in its nascent stages, and it's a long way from replacing defunct human organs. But the possibilities arising from not only improving diabetes diagnosis and treatment, but also cutting out animal testing are groundbreaking. The project received 3.6 million euros in funding from the EU's Horizon 2020 framework program, and the team plans to develop the first living model of the pancreas in the next 3 years. So although we are still some ways from a definitive cure for diabetes, the future is looking pretty bright.